Unfortunately, unintentional injuries are the number one cause of death in children ages 1 to 18. Hello, I'm Dr. Ricardo Gamez, board-certified pediatrician and part of the pediatric care team here at CommuniCare Health Centers. I want to take a couple moments of your time to discuss an important topic regarding the safety and health of your children, and that's unintentional injuries. Unfortunately, unintentional injuries are the number one cause of death in children ages 1 to 18. And those injuries, while we can't prevent all of them, we can prevent some of them, and I'd like to talk a little bit about that. What that equates to is about every 4 minutes a child is treated for an unintentional injury in an emergency department. And unfortunately, every hour a child dies because of an unintentional injury. Let's look at some of the ways that we can help protect our children. Motor vehicle injuries are actually the number one killer of children ages 1 to 18, based on information provided by the CDC. It is important to make sure that your child is always securely restrained in a vehicle while in transit. That's 100% of the time. 99.9% of the time is not enough. In fact, in the state of Texas, children under age 8 or 4 feet 9 inches tall should be restrained in an appropriately sized car seat or booster seat prior to being restrained in a 3-point harness. One of the things that parents can do is they can check the height and weight requirements of their safety seats, which are usually found on the sides of their car seats. One other thing to remember, if a car seat or a booster seat is ever involved in an accident, that car seat and booster seat should be replaced. Suffocation is the second leading cause of accidental injury in children, particularly those under age 1. One of the things that we can do is remember the ABCs of safe sleep. Babies should sleep alone, on their back, on a firm mattress, in a bassinet, or in a crib. In fact, as of November 2022, the Safe Baby Sleep Act, which was signed into federal law, prohibits the sale of padded bumpers as well as inclined sleepers in the United States. So if you do have any questions regarding the safety of any product you own for your child, make sure that you check the Consumer Product Safety Council's website at saferproducts.gov. And while somebody may think that drowning is a summertime event, actually drowning can occur at any point during the year. Some of the things to keep our children safe, particularly around water, are the following. If you're bathing your child in a tub, make sure that you're always within arm reach and never leave your child unattended in the tub. Children can drown in as little as 2 inches of water. In particular, for adolescents, they have the highest risk of accidental drowning in open water, meaning lakes and rivers. So if you do enjoy time on your lakes and rivers, make sure that you're always wearing a Coast Guard approved life vest. Swim lessons can help mitigate some of the risk, however, it cannot eliminate it. And the American Academy of Pediatrics recommends that children 12 months and older consider having swim lessons. Falls are another way that children are unintentionally hurt. One of the biggest things that we can do to help reduce this risk is to make sure that our children always wear helmets, in particular when they are riding their bikes, scooters, either hoverboards, and especially with all-terrain vehicles or four-wheelers. And finally, firearm safety. Suicide behind unintentional injury are the leading causes of death in adolescents. The American Academy of Pediatrics and the National Shooting Sports Foundation, through their Child Safe program, recommend that all firearms should be stored unloaded and locked. Ammunition should be also locked and stored separately from firearms. If you have any questions regarding these safety information, you can actually see the Foundation's website at projectchildsafe.org. Again, while we can't eliminate all risks to our children, there are things that we can do to help mitigate risks of unintentional injury in our children. If you have any further questions, your pediatric provider would be happy to answer any questions you may have. Thank you for watching.